All right, we're going to go ahead and get started. So first, thank you all for coming. This will be our second presentation for this first week of our grad school showcase. This presentation is going to focus mostly on the types of programs. Presenting today is going to be me, James Whitt. I'm an admin in the psychology department, and Mr. Gillison, who is the psychology academic advisor. So if you have any questions or anything, feel free to type those in the chat, and then we will be answering questions at the end, so you can also ask them there as well. So today we'll be going over the types of programs. First, we'll be talking about two kind of ancillary topics, which are accreditation and licensure. So these are going to be important kind of before and after picture program. And then we'll go over the types of program, which include graduate certificate, terminal masters, the Postmaster Certificate, as well as doctorate programs. So first we'll be going over the types of accreditation. So the first type is regional or national accreditation. So this accreditation is at the university level, and this shows that the university as a whole has met some amount of standards for this regulating body to show that they are able to confer accredited degrees. So for example, for UNC Charlotte, we're accredited by the SCOC, which is the Southern Association of Colleges and Schools Commission on Colleges. Yes, it's a very long acronym, but essentially they accreditate universities in the southern portion of the United States. And obviously there are other accrediting bodies depending on the part of the United States you're in. So the second type of accreditation is program accreditation. So this will either be a program as a whole or a track within a program. So for example, at UNC Charlotte in health psychology, the program as a whole is not accredited, but the clinical track within it is accredited by the APA. So the big reason it's important is because it will have an impact on your funding and employment. So if you choose an unaccredited program, that could mean you will get less funding or you will not get any funding to go to those programs, as well as once you finish, you may have a harder time getting employed if you do not have a degree from an accredited program. But that may not be the case. Depending on the subject and the field, there may not be anybody to accreditate them. So this is going to vary depending on what it is. So for example, if you're looking at doctoral programs in clinical, counseling, and school psychology, they can be accredited by the APA. And that's one of the kind of main people who will accreditate those programs. But for example, if you were going for just a Ph.D. in, for example, forensic psychology, APA doesn't accreditate those, so it wouldn't be important to look for that accreditation. Same if you were looking at like a master's level clinical psychology program. APA, again, would not accreditate that. They only accreditate the doctoral. So that's why it's important to kind of look to see if your program is accredited and then to see what bodies accreditate those programs, if any. Some other examples are things like the NASP, the PCSAS, the COAMFTE, et cetera, et cetera. So after accreditation's most important kind of before you get into your program, and then after, what is also important is licensure. So licensure is going to be specific to a state or region, normally state within the United States. And what that means is once you have finished a program, you are licensed to do some either therapy or something in that state by completing your program and other kind of requirements. So depending on the state, the requirements are going to differ. So if you, for example, wanted to practice as a therapist in North Carolina, in Charlotte, there's one set of rules for that. If you also, since we are close to the South Carolina border, wanted to also practice there, then there may be different requirements for that, and you would need to work on getting licensed in both. Normally, once you're licensed in one state, it can be a little bit easier to transfer that licensure to another one in case you move or something. But that's another thing to keep in mind is if you do go to a program in a state that you do not plan to stay in, you will need to think about kind of what you're going to do for licensing kind of once you're finished with your program and then after from there. So we'll talk a little bit about what it's like in North Carolina. So for North Carolina, there's two options. There is the LPA, which is the Licensed Psychological Associate, and then there's the LP, which is the Licensed Psychologist. So the main difference, and there's a couple other requirements that vary a little bit. The LPA is somebody who has completed a master's level program, whereas the LP is somebody who's completed a doctoral program. So again, if you go to the North Carolina Psychological Board's website, you can kind of go through the more specific things. And normally if you're in a program that would allow you to get this licensure, they can kind of work with you to make sure that you'll be able to attain this once you finish that program. All right, next we'll be going over the graduate certificate. So this is going to be the least time intensive of the graduate programs. So this one is on average going to be about 15 to 18 credits. It may vary kind of depending on what it is. Normally what you'll do is after you have finished a bachelor's, you can do a graduate certificate if you would like. This allows you to take additional study into a particular topic. So for example, if you finish with your bachelor's in like social work or psychology and you're working in a field that works primarily with older adults, you may want to do a graduate certificate in gerontology or something like that to kind of see if that's something you want to pursue further, or if you want to just get a little bit more information. And that's kind of what the graduate certificate's purpose is to give you more information and also to prepare you for further graduate studies if you do want to do that. The other thing to note is getting a graduate certificate will normally not give you licensure for anything. So it's not the same as getting a master's. So for example, in North Carolina, you couldn't become an LPA with just a graduate certificate. You would need to go on to do your master's. So next we'll talk about the masters, the terminal masters in particular. So what terminal means in this case is you are going into a master's program and you're going to finish that master's program. That's what a terminal master's is. Kind of the flip side to that is a master's program within a PhD program or other doctoral program. So what a lot of times will happen is when you enter a doctoral program, you may have the option to finish a master's program at the same time. So you would do that and kind of finish that up in your first 2 to 3 years. And that would not be your terminal master's. That would just be a master's degree. There is no actual difference in terms of like, if you saw somebody who had a terminal master's versus a regular master's, the terminal doesn't really mean anything different there. It just means that if you don't have a terminal master's, you have gone on to get further graduate studies at the doctoral level. So the terminal master's is about 2 to 3 years full time. So some popular areas within kind of psychology and psychology related fields are obviously psychology. Normally at the master's level, you can also kind of specialize in a particular area, such as the ones here, like social, clinical, developmental, etc. And this will give you, in addition to kind of some general psychological knowledge, you'll also kind of focus more heavily on that particular area, kind of like a concentration or a minor. Another popular one is social work, which would be the master's in social work. There's also counseling. The two main tracks you'll see are clinical and school. And you can also have additional specializations in things like addictions, marriage and family, art therapy, etc. And that would be kind of within the, so you could be, for example, a clinical marriage and family counselor, or a school counselor who does art therapy, that sort of thing. And then the other one that you may see sometimes is business administration, particularly in areas like human resources or management. Think of these kind of things as the flip side of industrial organizational psychology. So IO psychology normally will focus on research and the methodological approach, whereas if you go through a business administration to do human resources or management or something, you'll be doing more of a case study type schooling, which will be a little bit different. So like we said earlier, normally getting a master's will get you the ability to be licensed, depending on the state. There are some states that you may have to get to the doctorate level to get licensed at all. But again, that kind of depends on where you want to practice. The other thing is this is also good preparation for a PhD program. If, for example, you look at a PhD program and you think, maybe that's going to be a little too time intensive, or I'm not sure if I am a good enough candidate. Doing a master's program might be a good step to kind of see, hey, would I want to kind of do this for more long term? Or if you are kind of feeling like you're not as good a candidate, finishing your master's and everything could kind of boost up your research and other things and kind of get you prepared for that PhD level. The other thing to note is, like we said, this is going to be a little bit less competitive than a PhD. It's not going to be non-competitive, but for example, at the master's level, your acceptance rate is going to be about 50%, whereas the doctoral level, you're looking at almost 14%. Do know that this 50% or 14% is essentially all people with very similar academic records and experiences and stuff. So what's going to set you apart is going to be things like extra research, presenting at conferences, doing extra TA shifts and things like that. So it's going to be kind of those extra things that'll sell you, because probably 90 to 95% of these people all have kind of similar GPAs, GRE scores, and different things like that. So it's going to be that other stuff that's going to set you apart and get you accepted into these programs. So some general qualifications for a master's, and again, this is going to vary depending on the particular subject and the particular area, particular school and everything, but these are just kind of general. So you're looking at, normally that average is going to be about a 3.5 or up in psychology, or whatever field it is in. If it's in a psychology related field, but not particularly psychology, normally you're not going to see anything below a 3.0. Similar for your overall GPA, you're looking at a 3.5 average, 3.0 minimum. You're also looking at GRE scores that are at about the 50th percentile or above. Do know, though, at the master's level, there has been an increasing amount of programs that are either making the GRE scores optional or not including them at all. And this has a lot of different reasons, but the main thing you'll want to think about is, if you do have a little bit lower of a GPA and you think you'll do well on a GRE score, that might be a way to kind of boost you up a little bit and kind of even it out if it is optional within your program. But if it is optional, that's another thing to think about if you will need to do it at all. And then again, if you're looking at a psychology specific master's program, you're looking at, normally they'll want at least 18 hours in psych, including research methods. If you're looking at something like counseling or social work or something kind of else that's kind of similar to psych, they may not require a specific amount of credits in psych, but they may have other classes or different experiences that they'll want you to have. So just make sure that you've met those qualifications when you're looking at those programs. And the third type of program we're going to talk about is the Postmaster Certificate. So this is very similar to the graduate certificate, except this certificate you can only take after you've taken your master's. So again, this one's going to be about 15 to 18 credits, kind of depending on what the program wants. And this is going to give you additional specialization within a subfield. So for example, if you complete your master's in counseling, and you do kind of a general track, and then later on you decide you may want to introduce a new specialization like art therapy or play therapy or something, you may have the opportunity to do a Postmaster Certificate to kind of get licensed in that extra specialization or that extra subfield. All right, and now I will pass it over to Mr. Gillison to talk about doctoral programs.
So I'm going to be talking about some of the things that will go into considering a doctorate program. And there's a lot of different doctorate programs that we'll talk about, and they vary. But the variation and what you do within those programs is all going to be, program specific. And that's one of the things too that James and I will always encourage you to do, is if there's something you want to go for specifically, potentially it's a job or a certain degree, do a lot of research, because coming with an idea of what you want to go for is great, but knowing what it's going to take to become a student in that program, know some of the people who are involved in that program, and know some of the outcomes of that program, or even, potentially contacting someone who has the degree you want, would be a great first step into getting some of that valuable information that someone like me and James aren't going to have. So getting into the doctorate, 5 to 6 years full time, and that's not going to be a light 5 to 6 years. It's going to be a lot of work. It's going to keep you busy. I think that the main type of doctorate that a lot of students think about when they think about psychology is actually like an MD, which I think a lot of students think about the psychiatry track, or they're going to be considering a PhD in psych, which is going to be like a research-based psych degree. The PhD is the main one. There's counseling versus clinical, and there's a differentiation there, and we'll talk through those things together. There's the Psyd, which is more of an applied doctorate. and we'll talk through that as well. And then there's an EDD, which is a doctorate to consider when you're working in the college or working in a research kind of area. And then the MD, we'll talk about medical school stuff as well. And these are really competitive. I think the level that you ramp up competitiveness between a master's and a doctorate is more than double, if that makes it. Like it's a huge leap from how competitive it is to get into a master's program versus how competitive it is to get into PhD or another doctorate. And we'll talk through those qualifications. 3.7. Usually, if a student comes to me and they say, I want to go for a PhD, I will say, absolutely have your GPA above a 3.5, but it really should be closer to a 3.7 or above. That would be in psych and overall, because you don't want to have a 4.0 GPA and then like a 3.5 in psych. And then when they look at your transcripts, they see like you've slacked in some psych classes, because a program is going to look at all your transcripts, not just your transcript from your last school. That's why you have to submit them from everywhere. And then high GRE scores in the 70th percentile or above. And there are the GRE score thing has changed a few times just since I started at UNCC, but there is a way to look those scores up online and through APA. APA has like a list of like typical scores that are admitted for programs across the United States. So the big thing that we get to is like the PhD versus the Psyd. And PhD, regardless of what you're going for, is a doctorate of philosophy in that thing. The PhD is just a doctorate of philosophy. The PH is philosophy. And what that's essentially like, if you get a doctorate in education, or if you get a doctorate in math, it's a philosophy degree in that subject, because you're at a level of understanding in that subject to where you can come up with new ideas, break down old, mores, and kind of like, I guess, break the fourth wall, if you are following my drift, kind of like, because that's where you're going to be doing research to try to expand the field and make the field as precise as possible. And the only way to do that is to push the limits of what's already there. So it's a lot of research. You're going to be the emphasis is going to be on producing new knowledge and research, and that's where the philosophy aspect of that comes into play. The Psyd is a doctorate of psychology, and it's more of a professional degree, likened to the MD or the JD, which is a medical degree or a law degree, because it's going to emphasize application of psychological science to provide a service to individuals or groups. A lot of times, the one person I know in my personal life that has a Psyd, I know they at one point were a counselor, and they managed a counseling group in an office. And a lot of students that I talk to that want to get a PhD or a doctorate, a lot of times they're talking about a Psyd if they want to have that doctor in front of their name, because they essentially want to be a counselor and want to work with people one-on-one. And that would just be the next level up. Like when James was talking about a master's in counseling earlier, I feel like a Psyd is kind of like that next level. And it's not just restricted to like being a counselor, but that's kind of the way that you would go, because it's an applied degree more so than the PhD, which is more of a research degree. The university counseling programs, like a doctorate in counseling, on the counseling side of it, it would be someone who like works at the university counseling center that we have here on campus over near the health center. That would be a place that you could potentially wind up. And then mental health facilities or centers, working with individuals. Family service is a huge thing too. Part of the counseling program here at UNCC, the master's program, is play therapy, working with children. A lot of that stuff is going to go hand in hand, because in order to break down the micro, you have to kind of have an understanding of the macro aspect of it. What we were talking about here on the counseling side of things is work with healthier patients with less severe psychological problems, maybe focusing more on like emotional instability, stress, work-related issues, family issues, or school issues if you're talking with students, as opposed to some of the things that are more abnormal psych-based. And we'll talk about those as well. People talk about talk therapy. A lot of talk therapy is going to be like this, as opposed to, the psychiatry MD side, where we're going to be prescribing medicine and stuff for patients because we have that medical background. A clinical program organization similar to this would be like the university. You could also work in a health center. You could also have a private practice. And then a lot of people work in a hospital setting because each hospital will have a specific group within the hospital typically that are there to help address mental health care or mental health concerns. But like this says, you work with a broad range of psychopathology and clinical diagnoses and diagnoses. Like you're going to be potentially putting a name to something and conduct testing as to whether someone has ADD or ADHD or bipolar disorder and things like that, and being able to put a name to it to help that individual and work with them through the diagnosis as in the follow-up and the treatment of that thing. You have more extensive clinical training with more serious psychopathology issues such as bipolar disorder, schizophrenia, dissociative issues, and major depressive disorders. And then getting more into the education realm, an EDD is a doctorate in education, prepares for a career in educational leadership. My master's is essentially the level below this to work with college students and help them. And in that, you're going to have experience. You're going to work in almost like a counseling environment because some of you I've met with before, we've talked through things that we needed to talk through. There's a lot of preparing young individuals to be successful and help them on their path, as well as knowing the issues facing colleges and the ways to address those. You're going to be the EDD has a lot of research in it as well, emphasizes interpreting and applying research for real world settings. Some of the stuff that we would go through at the master's level, which was just a small snapshot of what you would be doing at the EDD level. What kind of obstacles are there for students to be successful in school? What kind of things can we do to help students become more successful in school? And that's just like a very small snapshot of what these people would do. The doctorate, the MD, Doctor of Medicine, allopathic medicine is just modern medicine or essentially Western medicine. Diagnose and treat human diseases. So you're going to be more on the, especially like if you go for psychiatry MD or MD and then you focus on psychology and psychiatry, you're going to be looking to diagnose and treat human issues or human diseases on that side of, because I'm sure there's a huge delineation. You know, you have all the different people that work in a hospital in a medical setting where oncology is a cancer work, someone that works with cancer patients, whereas a psychiatrist with an MD would work with people suffering mental health issues. The big difference between an MD and a PhD, in my experience, is you essentially go to med school to concentrate on psychology, as opposed to going to college, a doctorate program, essentially just concentrating on psychology. And one of the big differentiations there too is the ability to prescribe medicine and treat individuals on a medical level. DO, Doctor of Osteopathic Medicine. Osteopathic medicine is more like holistic medicine, like not just treating like the symptoms and the issue the person is having, but treating the person as a whole. And you can differentiate that really easily online. A lot of the research that was put into putting this together was, differentiating allopathic and osteopathic. Honestly, I'm not gonna lie to y'all, didn't know what allopathic was until yesterday. Never had heard that word. I've heard osteopathic 100 times. I've never heard allopathic in my entire life. But again, holistic diagnosis and treatment for patient, not just the symptoms. That might be a good thing if you want to help people and you want to incorporate a lot of different aspects of medicine and psychiatry and psychology in order to help them out.
All right, and that's the end of this session. So now we'll have some time to take any questions. If you have anything, just put them in the chat. AJ asked about the EDD being more applicable to academic advising rather than being professor. And that really kind of depends on the program. So the EDD is just a type of doctorate degree, but there's EDDs in many different things. So for example, UNC Charlotte has a couple different ones. But if you wanted to go specifically for academic advising, normally most academic advisors, and correct me if I'm wrong, will normally have a degree at the master's level. Then if you wanted to go further into like director of an academic advising center or something, at that point, you may want to look at an EDD in something like educational leadership or something similar to that.
That's right. Yeah.
Jeremy, you asked, is GRE score a requirement if I'm interested in a Master in Forensic Psychology? And that really depends on the program. So as we kind of mentioned, a lot of master's programs are moving towards GRE scores being optional, but it really kind of depends on the program. Right now, due to COVID and everything, most programs are making the GRE scores optional just because due to COVID, it's kind of hard to get things and everything. But past COVID and kind of pre-COVID, GRE scores and other test scores were slowly starting to become more optional, but it always depends on the program.
And the one thing too is like if you have a specific degree in mind that you want to go for, like a master's in forensic psych, do the research, see what options are out there, see what programs there are available, and then all of those programs are going to have their prereq list online, and some may say on there not requiring GRE anymore. There are some programs that are doing that now, and it specifically says there because GRE is expensive, and whenever I took it, you had to go sit in a little like cubicle in a really close room, and that's probably the antithesis of what they want people to be doing during COVID. So just check everywhere. Everywhere is going to have different requirements. I know that even some master's programs, they may not require a GRE, but you could do an MAT, which is the Miller's Analogy Test. And we offer that on campus, if I'm not mistaken.
Yeah, it's done through the counseling center. I forget, it's like 80, 90 bucks, something like that. And then they have like a testing schedule and you have to register and everything, but it is.
And the GRE is like $200 and some now per attempt.
Let's see. Oh, Brianna also had a question. Could a clinical child psychologist choose to go for their Psyd or Ph.D., or is it typically Ph.D.? So again, neither of us are like intimately familiar with kind of every subfield, but from our understanding, normally if you want to go clinical, you're looking at the Ph.D. level versus Psyd tends to be more general. So if you want to go specifically for clinical, you're wanting to go for a Ph.D. in clinical counseling or clinical psychology.
Yeah, and I'd say the same thing. The fact that you put clinical there makes me think more PhD than Psyd. Sorry, James.
I was just going to say, I think that catches us up with the chat questions. If you have any other questions, feel free to put them in chat or
unmute.
Raise your hand.
You could also.
So in a general speaking, I know that the GRE is slowly getting phased out. Would you say to just go for the GRE to be safe, or should we really look at the programs?
Check the program.
Okay.
Because you may want to apply a bunch of different places, and say you want to apply like 6 or 7 different places, and 6 of those places don't require a GRE, and the 7th one that did is one that you didn't really care about anyway. There's no need to take it if the 6 out of the 7 don't require it. And the other thing too is it's not being necessarily phased out. It's just been kind of like a weird thing in the last year where it seems like more and more places aren't requiring it. But like we were saying too, like, I don't know if it's more to do with COVID stuff or more to do with like lower numbers in grad school. So the best thing to do is just check their websites. And a lot of them are super easy to find online. You may have to click through a few pages just based on terrible website design, but you should be able to find it.
Yeah, and I would also say it kind of depends where you are in your academic career. So if you're like a freshman or sophomore and you're still kind of like exploring what program you want to do, probably kind of wait until you get closer. Most people are going to take the GRE kind of maybe starting the end of their sophomore year into their junior year, but normally it's during your junior year, kind of like the SAT for high school if you took that, or the ACT, kind of similar time frame. You're looking at normally your junior year, because that will be mostly what's going to be reflected when you're applying to grad school, is that kind of year before you apply.
Some programs, the application for the following fall is shortly into the previous fall. Like it could be even like September, October, November of say 2022 when you're trying to apply for a 2023 fall program.
One more. So can you typically find the accreditation that a master's program or, the programs on their website, or is that something that you're going to have to ask during the interview process?
No, that'll be something that is like probably clearly defined on their website, because it's the recruiting tool, if you will, for a lot of those programs, like whether or not like who you're accredited by and stuff like that. Because if you're looking at this great program that's in, they're gung-ho about you coming there, and then you look on their website and they're not accredited, or they're accredited by some body based on our standards that aren't the APA is like the golden standard, but the APA is also the golden standard only for one. What was it, James? Like clinical health programs. Is that what you said
So
yesterday?
they only do clinical, school psychology, and one other. I can't remember exactly what it is off the top of my head, but the APA, or like Mr. Gillison was saying, the APA is a very popular one, but they don't accreditate very many different types of programs. So I will say, for example, just because I'm more familiar with our program, so for health psychology PhD, on the very front page, it does, on their website, it says that this program has been APA accredited, and it'll give you more information on when they were accredited, when they're up for reaccreditation, and things like that. So normally it'll be very prominent. The thing you're going to want to look out is just kind of, you can also just do a Google search. So if you find, for example, somebody talked about a forensic psychology program, so you can just kind of Google like forensic psychology accreditation, and then you can kind of look and see who does accreditate that, if there is anybody. For some programs, there may not be an accrediting body. It kind of just depends on that subfield. And with the very niche ones, so as you get to very, very niche subfields and kind of subjects, you may find that there isn't an accreditation body, in which case that's when the school accreditation and the university accreditation, those are going to be important just to make sure that you have a university that can confer a degree that will be a benefit to you when you're looking for a career.
I'm a junior now, and if I were to, let's say there was a program that required me to take the GRE, but I didn't take the GRE until I was a senior, is that something that a grad school will look at as a bad thing, or is it just no, they don't feel any ways about it? It's like, okay, this score says this.
You would want the score to be available for them to look at as you, like when you apply to the school. You would want the score to be in the system for them to look at it when, like before the deadline or at the deadline. So definitely want to have it taken before the application process is due, like, or the application deadline is. You want to have it taken and sent to them, because that would just, I mean, submitting an incomplete application isn't a good look. They want students that can do everything and have all their, ducks in a row, if you will. So definitely having it done. If you're a junior now, what I would recommend you do is get one of the study books off like Amazon or something. They're really cheap. They're like $20 or $30 for like a, family Bible thick book of GRE questions, both, the quantitative and verbal reasoning. It has all of it in there. It's Kaplan and Princeton Review. Whenever I took the GRE, I grabbed the Kaplan book that was GRE Prep Plus for like 2014 or whatever it was. And I just, looked over it a little bit every day for, 6 months or whatever. And then I took it and I felt confident and I did well on the test. So it's something that's easy to prepare for. You just have to do, you just have to put the work in, and it's easy to get ready for it.
And if you're at a junior level now, they do offer it all year. So you could definitely take it over the summer. And if your score isn't where you want it to be, you could always take it again kind of as it gets closer to fall. But this will be a good time just because if you're not taking summer classes, you'll have a little bit more time to kind of focus on kind of preparing, and then can take it and then can retake it if you need to. And then depending on your school, if it is, or the programs you're looking at, it is optional. You also have the option of maybe not taking it if you feel you're a strong candidate otherwise. And if they do accept other tests, you also have the MAT, which is a little bit cheaper. It is also, not to go into it too much, but the GRE is a little bit of a longer test because it is more expensive, but the MAT is a little shorter. And that's partly due to the expenses, why they are such a time difference.
If we apply, so when is the period to apply for graduate school? Like the fall semester of your senior year?
Early fall, the year before you're planning to go in the fall. A lot of grad schools don't let you start in the spring. Some will let you start in the summer, but the majority of them don't want you starting until the fall semester. And the fall, like the application deadline for next fall 2022 is probably going to be sometime in, I would even say maybe even like early to mid fall of this year. Because like,
Okay.
I think our PhD program is November 15th. And that's one of the earlier ones I've seen, but I know that there are some that are even earlier than that because some grad schools are competing with other grad schools to get students in too. So they'll even like want the application in even earlier than that so they can extend an offer.
Yeah,
Okay.
if you're looking at a doctoral program for the fall of 2022, the application will normally open sometime this summer, and then the deadline will be sometime in the fall of this year. Kind of varies depending on the program. And then normally you'll go through an initial kind of period. Once the deadline goes through, then they'll send out for interviews normally. With COVID and everything, they may still be virtual this coming year. If not, you'll do them in person, and that'll normally be January into February. And then by March to April, you'll normally hear back, and then whether you're accepted or not, and then you would start that fall of 2022.
Because I'm not too terribly into my major at a junior right now. So I wouldn't be able to, like, if I were to apply, I wouldn't be able to show them much credit hours in psychology. So is applying for a master's program, even after college, something that's pretty normal, or it's like, okay?
Yeah, I mean, taking time off is totally understandable. A lot of students do it, but I would say that in the drop period between undergrad and grad school, a lot of students will start working and maybe lose the fire for the next thing. But looking at your record specifically, your classes, if you were to take and do well in the classes you're in now, which I'd expect you would based on what you've done so far, it wouldn't be outside of the realm of like, it wouldn't be weird for you to apply for a 2022 spot, and it would help even more if you took some summer classes potentially. But applying now at your hour level is for fall 2022 would be totally normal, because that's your graduation time should be spring 22, based on conversations we've had. It should, I mean, it can be
Mhm.
based on what you're wanting to do. But then also what I'll tell students too, if they work a lot, they have a lot of things that they're doing, don't cram everything in super, super tight at the end, because say you need to take 12 hours over the summer and then you need to take full time in fall and spring, and you work full time and you have a family or you have kids or something like that. That's not something that's going to be easy to do. And you don't want your GPA to dip at the end, especially in the upper level courses that you're going to be taking. Like your capstone class could be a good, I guess, test of whether or not you're going to be successful or, want to continue that pursuit in grad school, because that our seminar courses, our, psych seminar capstone courses are set up similar to a graduate level course. The way that they are, that's, the typical seminar style. So rushing everything at the end, doing badly, and then maybe not even, doing poorly in the classes that really matter is, that would look bad.
So I'm not sure if I'm set to graduate fall or spring of 2022. So if I were to graduate, if it was projected
Hmm.
fall, and that would be adding on to my schedule. If I decided like I'm going to take classes, I'm going to take spring, like I'll just elongate it.
Uh-huh.
That would probably look good, because I would continue the school, and then the possibility of the graduate school following fall.
I think if you were to spread it out and then finish in fall 2022 and do really well over the next 4 semesters, that would look great for a fall 2023 graduate school application. And that would give you plenty of time to get ready for the GRE. That would give you plenty of time to explore other opportunities in the department, whether that's a research assistantship, a teaching assistantship. What am I thinking about? The honors program with Dr. Levins. That
Yes.
would be a great
Okay.
thing too.
So that would be adding on an extra like year or
Just
semester.
a semester. Yeah.
Okay. Okay, that is definitely, it's something I want to do, because I do want to participate in honors and research. I want to get all those things done,
Sure.
but I don't want to like add it all together and then possibly like skip and fall and like really bruise my GPA.
Sure. Yeah, that makes sense.
Okay, cool. That actually makes me feel a lot more confident. Thank you so much.
Yeah.
All right, so if we have no more questions, we will conclude this session for today. Thank you so much for joining us. Have a good night.